Hello, my friends. Good morning. It is Dr. Darla, and today I want to talk a little bit about something that you might not immediately connect as a source of joint pain, and that is food reactions. So, the thing that's really important to remember is that the food that you put into your body is a big determining factor, not just of your overall health, but specifically what I want to talk about, your joint health, your creakiness, your aches and pains, your ability to heal well. It is a huge source, or can be a huge source, of inflammation in the body, which oftentimes lands in the joints. So when we think about food intolerances, sometimes we refer to them very, very loosely in the world as food allergies. And I want to make a quick little differentiation for you on food allergies versus food intolerances. So the immune system has a few different ways that it responds in regards to food. And the immune system has an actual allergy, which is called an IgE reaction. That's an anaphylactic type of reaction. It's immediate, it's life-threatening, it's obvious. So if you eat something that you are allergic to, and within a few minutes, you may have a tingling mouth or closing throat, difficulty breathing, hives. That's really, really obvious that that food is something that you're allergic to and you shouldn't eat that. Right? It's a life-threatening type of allergy, and you should probably have an EpiPen. But there's a different part of the immune system that is less well known, and that is an IgG reaction, and that is a delayed sensitivity. And that's really what I want to talk about today. So while the anaphylactic IgE reaction will happen right away, an IgG reaction, which is a delayed sensitivity, can take up to 3 days for you to feel those symptoms. So that's less obvious when you eat a food and then 2 days later your joints ache. It's less obvious that it's the food you ate 2 days prior. We also see a variety of symptoms that go along with that type of reaction, including joint pain. When somebody comes in and they have a complaint that all of my joints hurt, that's one of the things that I consider is what's happening in the digestive system, what's happening with the food that's being brought in, what's the health of the gut, what are the microbial status, the microbiome, if you will, what does that look like, how many courses of antibiotics have they been on over their life, what does their stress level look like, what types of foods are they consuming on a regular basis, because it has such a big impact in inflammation and in joint pain. So if you are highly inflamed, you may feel all of the joints in your body, your fingers, your wrists, your elbows, your knees, your shoulders. And that's very different from I had some kind of injury and now my shoulder hurts. Right? When all of the joints hurt, we need to look at what's going on in all of the body as opposed to just an individual joint. So it's really important to differentiate those things. But my point about really recognizing what foods you might be eating and that could be contributing to the joint pain that you have. For some people, they have disease processes that cause a lot of joint pain, like rheumatoid arthritis, psoriatic arthritis. Sometimes we'll see multiple joints associated with gouty arthritis as well. And those have to be dealt with. Those are autoimmune diseases and metabolic disorders, but food does definitely play a big role in that, including the food intolerances that you have. So anytime that you've got joint pain and it's not an obvious injury, like I was doing pull-ups in the gym and now my shoulder hurts, that's an obvious injury. I was in a car accident and now I have headaches and my neck hurts, that's an obvious injury. But when we have just sort of, I don't know, I just every morning when I wake up, I'm just creaky and achy, that's not really an obvious injury. And food intolerances should be one of the things that you are considering with that. So your food is very, very important to your joint health. And There are some testing things that can be done. I'm not going to go into all of that today, just to kind of keep this video a little bit shorter. But there's definitely ways that you can test it. There's ways that you can challenge it. And I'm happy to answer any of those questions if you have them. You can always call the office, schedule an appointment. We can help you kind of suss through that information as well. But remember, your food is important in your joint health. I will talk to you soon. Hope you guys are having a great day. It is Friday. Looking forward to the weekend, and I hope that you get some time to move, drink water, and breathe some good fresh air. Talk to you soon. Bye-bye. Dr. Logan.